Have you ever watched your child take a hard fall or a hit and wondered, does he have a concussion? As parents, we all want to do what's right by our kids. We want to protect them, make the best decisions for their health, and ensure that they can keep doing the things that they love. But when it comes to concussions, the signs aren't always obvious, and the pressure to get them back on the field or in the classroom can be overwhelming. Hi, I'm Dr. Jason Hahn, sports clinical specialist and CEO of HealthFit Physical Therapy and Chiropractic. Today, I'm going to walk you through 5 of the most common symptoms of a concussion in children so you can recognize the signs, trust your instincts, and make the best decision for your child's health. We often think concussions only happen in high contact sports like football or hockey. But the truth, a concussion can happen anywhere, at any time. A fall off the playground slide, a collision during recess, even a sudden jolt in a minor car accident. And here's something a lot of parents don't realize. Most concussions don't involve losing consciousness. Your child might not even seem that hurt in the moment, but the symptoms, they can creep in over time, sometimes hours or even days later. What makes it even harder? The external pressure to get them back to their normal routine. They have a big game next week. They'll be fine. They need to keep up in school. They can't afford to miss another class. Other kids playing through this all the time. You're being too cautious. I get it. No one wants to see their child sit out, especially if they love their sport or are working hard in school. But trust me, returning too soon can make things so much worse. Concussions are traumatic brain injuries, and rushing back before the brain has fully healed can lead to long-term complications, prolonged symptoms, increased risk of future concussions, even lasting cognitive issues. That is why it is so important to know the signs and act fast. So, let's talk about the 5 most common symptoms of a concussion in kids. Number 1, headache or pressure in the head. One of the first things a child might complain about is a persistent headache. It might start off as mild discomfort, or they may describe a sensation of pressure that just won't go away. Number 2, dizziness or balance issues. Watch how they move. Are they suddenly off balance? Are they stumbling when they walk? Are they feeling lightheaded? Their brain may be struggling to process movements properly. Number 3, nausea or vomiting. A concussion can disrupt your body's normal processing, leading to an upset stomach. If your child feels queasy or starts vomiting without clear cause, this is a major flag. Number 4, sensitivity to light or noise. Does your child seem bothered by bright lights or loud noises? Are they covering their eyes or their ears more than usual? Sensory overload is a common concussion symptom. Number 5, difficulty concentrating or memory problems. Pay attention if your child suddenly has trouble focusing, remembering things, or following directions. If they're struggling in school or seem off in conversations with you, their brain might be signaling for help. So, let's talk about why this matters. Let me share a real life story that highlights just how important it is to catch these symptoms early. A few years ago, a boy named Jack was playing soccer when he took a hard hit to the head. He looked a little shaken up, but he told his coach he felt fine. His parents were worried, but the coach reassured them it's just a minor knock, he'll be okay. So Jack, he kept playing. Later that night, he started feeling dizzy. The next day, he complained of headaches and trouble concentrating in school. Over the next few weeks, things got even worse. He had trouble remembering things, struggling to keep up in class, and even started feeling anxious and irritable. By the time his parents took him to the specialist, they had realized he had suffered a serious concussion and had been pushing through it for weeks. Because he didn't seek medical guidance and treatment, his recovery took months. Months of missed school, missed sports, and a lot of frustration. This is the reality of undiagnosed concussions. If Jack's symptoms had been recognized earlier, his recovery could have been much shorter and he wouldn't have had to suffer the long-term effects. So, what should you do if you suspect a concussion? If your child takes a hard hit to the head, trust your instincts. Even if they say they feel fine, here's what you should do. 1. Remove them from play or activity immediately, whether it's sports, school, or even just roughhousing at home. Number 2. Monitor their symptoms closely. Some might not appear right away, so keep checking in over time the next few days. Number 3. Seek medical evaluation. Here at HealthFit, we have an FDA cleared concussion and traumatic brain injury system that can analyze your eye and brain activity in just under 4 minutes. In addition, our concussion experts can assess the severity and guide you through your recovery. Number 3, prioritize rest and recovery. Limiting screen time, avoiding bright lights, and taking a break from physical activity will help their brain heal faster. Number 4, don't rush their return. Even if the coach, teacher, or your child themselves wants to get back to normal quickly, healing takes time. A second concussion before fully recovering can have serious, lasting consequences. As parents, we face so much pressure from coaches, from schools, from society to tough it out and get our kids back to normal as soon as possible. But when it comes to concussions, there's no such thing as being too careful. Thank you for watching, and remember, your child only has one brain. Your child's health is worth it, and let's make sure they get the care that they deserve. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.